Hey everyone, welcome back to the Pulse of Life. Today, we're diving into a topic that's often overlooked but super important: drinks for kidney disease patients. If you or a loved one has kidney disease, you probably know how important it is to carefully monitor what you consume, and that includes drinks. Staying hydrated is essential, but some beverages can put unnecessary strain on the kidneys. On the flip side, there are some surprising drinks that help promote kidney health and keep you feeling your best. In this video, we'll explore what drinks are safe for kidney disease patients, the ones to limit or avoid, and some tips for making hydration easier. So, if you're ready to learn how to quench your thirst safely, let's get started. Understanding kidney disease and fluid management. Before we get into the specific drinks, let's talk briefly about how kidneys and fluids are connected. The kidneys play a major role in filtering waste, balancing electrolytes, and regulating fluid levels in the body. When your kidneys aren't functioning properly, too much fluid can build up, causing swelling, shortness of breath, and high blood pressure. That's why people with kidney disease often need to be very careful about both their fluid intake and the types of liquids they consume. But the goal isn't just restriction, it's also about finding the right balance. Hydration is still key to avoiding dehydration, which can make kidney problems worse. So, let's jump into the best beverages that help kidney disease patients stay hydrated without putting extra strain on their kidneys. The best safe drinks for kidney disease patients. 1. Water. The gold standard water will always be the top recommendation. It's the most natural way to stay hydrated without any added sugars or harmful ingredients. But keep in mind that too much water can be risky for people with advanced kidney disease, especially those on dialysis. Work with your doctor to figure out the right amount of water for you. Pro tip: add a squeeze of lemon to your water. Lemon not only adds flavor but can also reduce the risk of kidney stones due to its high citrate content. 2. Herbal teas. Caffeine-free herbal teas are a great option, especially caffeine-free varieties like chamomile, peppermint, or rooibos. These teas are soothing and contain antioxidants that may help reduce inflammation in the body. Plus, herbal teas are generally low in potassium, making them kidney-friendly. Avoid black or green teas, which are high in oxalates, a compound that can contribute to kidney stones. 3. Cranberry juice. In moderation, cranberry juice is often recommended because it can help prevent urinary tract infections, UTIs, which are common in kidney patients. However, opt for unsweetened cranberry juice to avoid added sugars, and limit the portion to small amounts. Too much juice can still overload the kidneys with sugar and potassium. 4. Coconut water. Occasionally, coconut water is a hydrating drink that contains electrolytes like potassium and magnesium. It's great in small amounts, especially if you need to replenish electrolytes after activity. But be careful, coconut water is naturally high in potassium, so it may not be suitable if you have high potassium levels. 5. Smoothies with kidney-friendly ingredients. Smoothies can be a delicious way to stay hydrated, but you'll need to be careful with the ingredients. Use low-potassium fruits like blueberries, apples, or strawberries, and blend them with water or non-dairy milk for a tasty and refreshing drink. Avoid adding bananas or oranges, as they are high in potassium. Pro tip: adding chia seeds to your smoothie can provide fiber and omega-3s, which support overall health. 6. Sparkling water or flavored seltzers. If plain water feels boring, try sparkling water or seltzers without added sugar. These are great for hydration without extra calories, and many come in natural fruit flavors. Just make sure the drinks you choose are free of sodium and artificial sweeteners. Drinks to avoid or limit. While some drinks are safe and beneficial, others should be limited or avoided by kidney disease patients to prevent complications. 1. Sugary sodas and soft drink sodas, especially cola, contain phosphoric acid, which can harm the kidneys and increase the risk of bone disease by affecting calcium levels. Additionally, sodas are loaded with sugar, which can lead to weight gain and worsen kidney function. 2. Fruit juices. High in potassium juices like orange juice or tomato juice contain high amounts of potassium, which can be dangerous for those with kidney disease. Elevated potassium levels can cause heart problems, so it's important to avoid or limit these juices. 3. Caffeinated beverages. Caffeine can act as a diuretic, leading to dehydration and increased blood pressure, both of which are harmful to the kidneys. Limit your intake of coffee, black tea, and energy drinks. If you really need a boost, opt for decaf coffee instead. 4. Alcohol. Alcohol can increase blood pressure and impair kidney function. If you have kidney disease, it's best to avoid alcohol entirely or consume it in very limited amounts. Even small amounts can interfere with medications and affect your kidney's ability to filter waste. Tips for managing fluid intake. Managing how much you drink can be tricky, especially if you need to limit fluid intake. Here are a few tips to help you stay hydrated without going overboard. Monitor your daily fluid intake by using a measuring cup or tracking app. Eat water-rich foods like cucumber, watermelon, or lettuce to stay hydrated without drinking too much liquid. Suck on ice chips or frozen fruit for a refreshing way to hydrate slowly. Use a small cup to drink smaller portions throughout the day rather than large amounts all at once. Real-life success story: how hydration helped Tom manage kidney disease. Let's take a moment to hear from Tom, a kidney disease patient who struggled with managing his fluid intake. Tom found that drinking herbal teas and flavored water helped him stay hydrated without putting stress on his kidneys. I used to feel overwhelmed trying to drink enough water without overdoing it. Once I discovered herbal teas and low-potassium smoothies, it became easier to manage my fluids. My energy levels improved, and I felt more in control of my health. Tom's story shows that finding safe and enjoyable drinks can make a big difference in managing kidney disease. Conclusion: drink smart, stay healthy. So, what drinks are safe for kidney disease patients? Stick with water, herbal teas, low-potassium smoothies, and small amounts of cranberry juice or coconut water. Avoid sugary sodas, caffeinated drinks, and high-potassium juices to keep your kidneys functioning their best. Remember, every kidney patient's needs are different, so always consult with your doctor to tailor your fluid intake to your specific condition. Staying hydrated is essential, but the right drinks can make all the difference in supporting your kidney health. Final thoughts. Thanks for tuning in. If you found this video helpful, like, share, and subscribe for more content on health and wellness. What's your go-to drink for staying hydrated? Let me know in the comments below. I'd love to hear your tips. Watch next: Top 5 Foods You Should Avoid If You Have Kidney Disease. Until next time, stay healthy and hydrated.